We need more and more Americans to speak out as they know about this bill and say, no way, and to call their representatives and their United States senators in order to ensure that this is not something they'll vote for. And one of our best hopes for doing so, perhaps the only way we can do so, is if more Americans do what the brave New Jerseyans I'm about to present to you are doing today. They're sharing their personal health care stories. They're talking about what health care means to them and what a repeal of the Affordable Care Act will mean for their families.
I have a teenage son, Adam, and he has a rare muscle disease. And he couldn't be here today, but I did bring his wheelchair. And you can see the note that's on there is that that's his manual wheelchair that costs thousands of dollars. And you should see the bill for his power wheelchair. So his disease results in weakness and fatigue that makes a regular day feel like a marathon. Right now, he gets support for nursing. He needs a one-to-one nurse. And when he goes to school every day, he has a one-to-one nurse. And that is provided for him by the school district because he hasn't graduated yet. When he graduates, he's going to need daily nursing care. And turns out that our private insurance doesn't cover that. And so when he's 18, our plan for him was to apply for Medicaid so that he could get that support to attend school. Right now, he gets great, reasonable, affordable care under Obamacare through my husband's employer. But like I said, they don't cover nursing coverage. And what happens, if they turn him away because of a pre-existing condition, or what happens when he turns 26? We cannot afford to pay for his medical expenses, and that's even with the private health insurance. So I am not a welfare queen. My son is not looking for a free handout. He's bright, he's hardworking, and he needs a leg up from Medicaid so that he can pursue his academic and career goals. Right now, he's getting good care, and they're saying that Obamacare is failing. Well, guess what? It's really working for us. Yes. And not only that, I think it's actively being sabotaged. Yes. So, first of all, I want to really thank Senator Menendez for fighting for families and kids like mine. And I need Congress to reject this mean-spirited bill. And also, this is not what President Trump and candidate Trump promised Americans. Exactly. So if he realized what was in this bill, I don't think he'd like this bill either.
If they take away the Affordable Care Act now and the Medicaid that my family's on, we will lose our house. We'll be bankrupt. So, and then my son has a pre-existing condition. He was born with hearing loss. He has 70% hearing loss in his ears. I noticed Senator Menendez has hearing aids. My son has hearing aids, and he would not be covered should we be pulled out of the Medicaid.
My daughter Lori is 47 years old. She has intellectual and developmental disabilities. She's lived in a home for 21 years, programmed by the ARC of Essex County, which I can proudly say, from my experience, is one of the best ARCs in the state of New Jersey. Her life is dependent on Medicaid. Lori has complex medical needs. She has frequent seizures, averaging about 15 a month. She requires round-the-clock support. She will always need long-term support services throughout her lifetime, and it is because of Medicaid that these support services are possible. Should the Senate move forward with the American Health Care Act and these significant cuts to Medicaid, they will be putting Lori's life at risk and other people like Lori that live in her group home too. I worry about Lori and what will happen when my husband and I are no longer here. Right now, I feel confident that Lori is part of the community and part of a home where the staff provides these critically needed services for her. If Medicaid is slashed, like the Senate is proposing, her life in a group home is in jeopardy.
We're in the midst of an opiate epidemic right now, right? And to even have something like this on the table, it's almost an abomination for us as American citizens, correct? Well, I'm going to tell you a little story about a young man who suffered with addiction for quite some time, 20 plus years. The thing about Medicaid with him is that when he was able to come out of incarceration, he was released from prison, he came home with absolutely nothing. But there was one thing that was available for him, and that was Medicaid. It was able to take care of his physical health, his mental health, his emotional stability. All of these things were done through Medicaid assistance. So now this individual works for a place, I said, Cares New Jersey in Rockaway, and he's helping other individuals get on that pathway to recovery. And I'll tell you a little bit about that. This individual has transitioned about 264 people into treatment since August of last year, with 70+% of those individuals having what? Medicaid. So this is essential in the fight against the opiate epidemic. I know so much about this individual because that individual that we're talking about is me. So I thank you so much for being here, Senator Menendez, to help us.
This is my daughter, Leandra Delgado. Say hi. Leandra is 13 years old. She has a very rare muscle disease condition that causes her muscle to not work how they're supposed to work. She is deaf also, and she has 9 surgeries, and she used 8 different doctors, specialists, and 18 medications every day. My daughter go through a lot. She was using a tracheostomy and ventilator for breathe, and now she's not using it. Her life is really struggle every day, try to breathe by herself. At night, she uses oxygen and CPAP machine to try to breathe. She go to school every day. She's a very happy girl. She loves to play with other kids. She play a violin. And I want to keep my daughter alive. And every night, every single night, I just thinking how I gotta do it if I don't have enough affordable care to cover all the medication that she needs. And the oxygen is one day the company say I cannot bring you more oxygen to Leandra because you don't have insurance or your insurance is not covered for. My daughter has pain every day because her muscles are so weak that her bones, it's pain on her bones because her muscles are so weak. I just asking everyone, what is this about? What we are doing every day? Why we vote? What is it about? It's about having a 13 years old in risk to lose her insurance. Who she wants to live. She wants to play. She wants to continue. Even she has to drink 18 medications per day. And she loves to be in this war. She loves and enjoy being with other kids. She loves to be with her family. And I want to keep my daughter alive. And thank you, Senator, for being here and help us to keep Medicaid and affordable care for those kids who really need it, because she's not the only one.
Well, that's more powerful than anything that is left for me to say. I appreciate all of you sharing your stories. It's not easy to talk about your personal health challenges in front of an audience, much less cameras. It's not easy to talk about personal health issues in public, but I think the stories are pretty sobering. It's far more powerful than anything I've said about what this fight is all about. You know, in the greatest country on the face of the earth, they can do far better than this. I think Senate Republicans made a choice with this bill, and they didn't choose you. They didn't choose Eileen's daughter or Sarah's son. They didn't choose Thomas and his family. They didn't choose Alton or Elaine. Really, this bill sells out our healthcare system to millionaires and insurance executives. And at what price? The price is the healthcare and well-being of all of us.